well, first let me begin by telling you what the Senate bill, reminding you what the Senate bill originally was. This was a mandate that all large group policies in the state of Florida provide coverage for children with autism spectrum disorder that would provide $36,000 a year maximum coverage. There was no maximum lifetime benefit. It was just until they aged out. And there was no, and there was $36,000 for ABA plus the other coverages such as speech therapy, occupational therapy, etc. That the studies have shown that if it's just autism, then the increase in mandated coverage premium ranges from 0.26 to 0.47%. Excuse me, 0.26 to 0.47. Again, 1/4 to 1/2 of 1%.
And I know it's late in session, 2 weeks left. I know this is kind of broad thinking and a big proposal, but I really think it's worth our time. I'm here today to give you a pep talk. As I look at, I've appointed each of you to this, and there's a reason why I appointed you to this, because I know that you're believers, I know that you're passionate, I know you understand the issue, I know that you're committed to solving problems like these. So I don't need to inspire you to do anything. I'm here today to show you the commitment at the highest levels of leadership. Because as we enter these last 2 weeks, the two biggest things that people will bring up as to why something like this can't happen is, number one, money, and number two, time. Do we have enough time and do we have enough money to get something like this done? And I just wanted to come down here today to tell you that yes on both. That I believe that this is a proposal important enough, life-changing enough, earth-shattering enough, that you have the commitment from the highest levels of leadership in this body that we want to get something done.
But we do have a full agenda of public testimony, and we want to try to give everybody ample time to express their opinion on this very important issue.
Do you have any thoughts on the insurance component that we're considering?
It's a very sad state of affairs when an insurance company says, we can't help you, you're not covered. We don't have to and we're not going to. Very sad.
He did not get everything he needed. He did not get what was recommended. He's in a class of 7 kids, all autistic. And he, I don't know if he'll ever live alone, if he'll ever be able to take care of himself, because he didn't get what he needed. And as parents, it just kills us that they didn't get what they needed. And it all comes down to money. We didn't have the money to pay out of pocket. But we had insurance. We had good insurance. And the insurance told us not covered. Sorry.
So I did go to the Dan Marino Center, and they said, well, yes, but you need a neuropsych evaluation to actually determine this, and we're sorry, but your insurance won't cover that.
And so I went home, and I'm like, okay, we need behavior therapy and speech therapy, and I have great insurance, so it's going to cover it. And I called my employer, and they said, oh, I don't think we cover that.
I have insurance that covers a lot of things. My daughter's epilepsy is covered, but we had the same situation with the speech therapies and things, the limitations and those.
I've heard it over and over and over and over and over. So we're going to see if it works with you guys. We need insurance.
That even though there are aggressive treatments available for my son, the insurance program that I've been paying into for over 20 years does not cover it.
In 2007, my husband and I spent over $75,000 just in 2007 on my son's treatment. Not one penny of this has been paid by the insurance companies.
We had great insurance, but none of the therapies that we did were covered by insurance, and it cost us thousands and thousands of dollars. Luckily, we could afford it, but lots of parents here cannot.
Lucky or unlucky, however you want to look at it, we had services already associated to our pre-existing condition, but we did not and would not have had services associated with the autism only.
And we went through the whole, I've always felt that insurance was discriminatory because, you know, like everyone else here, we paid our premium, we got no services.
We've got 17 states that allow for the mandated coverage. Are we going to have anybody from the insurance industry present to us as to their position on this? Because I think that's a crucial piece of the puzzle that we have an opportunity to hear from and to ask questions of.
Questions that you may have. Probably the biggest portion of this particular proposal that has already been discussed is the lifting of the full pay cap when it comes to healthy kids, or I continue to call kid care. That would allow for the opportunity for a family to purchase in to that policy. We would expand that policy to cover ABA, as well as related services, speech therapy, occupational therapy, and all of those therapies that are potentially available, especially for a child with disability. We also put a component in here that directs ACA to request a Medicaid state plan that also would enhance benefits for individuals with autism as well as related disabilities. Another issue that we heard quite a bit about in our discussions was the lack of early diagnosis. Pediatricians that didn't necessarily know the signs. We put in this particular bill a requirement that during continuing education courses, that is one of the issues that they have to go through, is to actually understand exactly what's involved in that. We allow for a compact, and we say that we want to negotiate with the insurance companies, and that's everybody, those that are RISA exempt as well as state plans. And there's a trigger that on a particular date, if they have not entered into an agreement with ACA to abide by the standards that we put forward, that a mandate would take effect, and that we would lay out what that mandate is, what we expect them to cover. We've heard testimony about how important the card system is in the card regions. We want to empower them, and we want to expand them, and the way we want to do that is that we put in there a definition that allows for more flexibility, more empowerment when it comes to all disabilities. And the way that the legislation is written is that we take the card systems and we allow them to be really the clearinghouse for everything in a particular community. So if a child at birth is diagnosed with Down syndrome, or a child at 4 or 5 years old is diagnosed with autism, there would be one location that could serve as a clearinghouse as to what benefits would be available through kid care, what insurance options there may be, what therapies have been approved, what ABA has been approved. All of that would actually work through the card system. And I always get it mixed up. Gateway to Learning?
Learning Gateway.
Learning Gateway. We're going to have to change that because I always call it the other way. We bring that back. That was put in place as a pilot program. We actually expand that, and we have them working with the card systems to making sure that all of the services are being met. We allow for a statewide board of governors through that, of advocates that can work with the secretaries of ACA, APD, and all the relevant agencies to make sure that all of the services are being met. VPK. The reality is a lot of children with a disability do not participate in VPK because they're not prepared and they're not ready. We want to provide flexibility within VPK for the services that a family needs, therapies, occupational therapy, physical therapy, in an approved setting, but we want to provide that flexibility to a family for them to participate in that. The way it is now with the McKay Scholarship is that you would have to actually be in the school system for 1 year. We want to change that, and we want flexibility to waive that 1 year component. So if a child is in VPK and they're being provided the appropriate services, they would still have to have an IEP, so it wouldn't be completely open. They still would have to go through a process to determine what their needs were, but they could seamlessly move right into a facility or a situation that's best for them.